In the spring of 2022, Hollywood lost one of its most beloved action heroes to a devastating diagnosis. Bruce Willis, the man who brought us John McClane and countless memorable characters, stepped away from acting due to a condition called aphasia. Later that year, his family revealed a more specific diagnosis: frontotemporal dementia, specifically primary progressive aphasia. Today we'll explore what this means, how it affects those diagnosed, and what families can do to maintain quality of life. Frontotemporal dementia isn't a single disease, but a group of disorders affecting the brain's frontal and temporal lobes. These areas behind your forehead and ears control personality, behavior, language, and executive functions. Unlike Alzheimer's disease, FTD primarily impacts behavior and language rather than memory in early stages. While Alzheimer's typically affects older adults and begins with memory loss, FTD often strikes between ages 45 and 65. Bruce Willis was 67 when diagnosed, which is slightly older than the typical onset age. FTD is caused by abnormal protein accumulation in brain cells, leading to their damage and eventual death. Two main proteins are involved: tau protein, which forms clumps inside neurons, and TDP-43 protein, which misfolds and accumulates. These protein buildups disrupt normal cell function and trigger the progressive symptoms we see in FTD. About 10 to 30% of FTD cases are inherited, involving mutations in specific genes like C9 or 72, MAPI, and GRN. Having a family history of FTD is the biggest known risk factor for developing the condition. However, 70 to 90% of cases occur spontaneously with no known family history or clear trigger. Bruce Willis has primary progressive aphasia, where language abilities are primarily affected first. Early symptoms include difficulty finding words, struggling to recall names of objects or people. Speech becomes halting and effortful, with problems understanding word meanings and loss of reading and writing skills. As the condition progresses, comprehension difficulties worsen, especially with less common words. Eventually, the person may become largely or completely nonverbal, losing the ability to express themselves through speech. It's crucial to understand that intelligence and awareness often remain intact even when language abilities decline. Other FTD variants may cause personality changes, loss of empathy, compulsive behaviors, and poor judgment. Problems with planning, organizing, and abstract thinking may develop as executive function declines. While there's no cure for FTD and no treatments can slow its progression, management focuses on quality of life. No FDA-approved drugs exist for FTD, but doctors may use medications off-label to manage symptoms like depression or agitation. Treatment must be carefully monitored due to potential side effects and the unique nature of each case. Speech and language therapy is crucial for PPA patients, teaching alternative communication strategies like gestures and digital apps. Occupational therapy helps patients adapt daily routines and environments to maintain independence longer. Physical therapy addresses mobility, balance, and strength issues that may develop in later stages. Effective communication involves speaking in simple, clear sentences and being patient with responses. Visual cues, gestures, and yes or no questions are easier than open-ended ones. Focus on emotional intent rather than correcting errors. Pointing to objects and using communication boards can bridge gaps when words become difficult. Creating a structured routine reduces anxiety and confusion. Keep daily activities like meals and bedtime consistent. Adapt the environment by reducing clutter, using labels and pictures, and ensuring safety measures are in place. Predictability becomes increasingly important as executive function declines. When managing behavioral symptoms, redirect attention rather than confronting compulsive behaviors directly. Distraction with simple, enjoyable activities can help when agitation occurs. Remain calm, as caregiver frustration can escalate situations. Monitor eating and drinking carefully to prevent choking, as swallowing difficulties may develop in later stages. FTD is exceptionally demanding on families. The personality changes can be heartbreaking and stressful for caregivers. Utilizing support groups through organizations like the Association for Frontotemporal Degeneration and Respite Care Services is essential. Early legal and financial planning, including advance directives and power of attorney, protects everyone involved. Bruce Willis's family emphasizes the importance of love, support, and creating joy in each moment. While FTD presents enormous challenges, focusing on connection, dignity, and quality moments can provide meaning and comfort. Thank you for watching this important information about frontotemporal dementia. Please like this video and subscribe to our channel for more health education content. Together we can raise awareness and support families facing these challenges.